Thank you so much for joining us today. My name is Ashley Craven, and I am the Marketing Director of Griffin House. And today we are joined by Dr. Thomas Bond. Dr. Bond has tons of experience in early childhood. She has more than 14 years experience as a child care licensing consultant, 30 years in early childhood education on top of that. And she's earned her doctorate in organizational leadership and works with program directors to help them build centers that are not only safe for children, but also provide quality learning environments. So you get a double whammy. She's most certainly sought after for as a panelist, as a presenter. She researches and writes articles on her blog. And of course, she is a Griffin House author. She recently wrote a book that was just published last month called Build Your Dream Team, How to Recruit, Train, and Retain Your Early Childhood Staff. So Dr. Bond, hello, and thank you so much for joining us today.
Hello, Ashley, and thank you for that wonderful introduction.
Of course, yes. So today we wanted to chat through a lot of what's on people's minds right now in the early education field. And, you know, of course, in light of a global pandemic and so much happening in our country right now and across the world, we want to make sure that, you know, we're helping to guide those in the profession, you know, guide them to success. And today we thought we could share some quick tips about recruiting, training, and retaining your dream team during COVID-19, during this pandemic.
This is something that has really affected the early childhood profession in a major way. There has never been a time where early childhood centers were closed at the same time. And so it's really created an issue with now reopening, because you've had staff who are afraid to come back to work because they're afraid of the unknown. There's so many things that have been changing as a result of COVID-19 that now centers have to put health and safety issues in place as they start to reopen. And that affects so many things. It affects recruiting, because now you're looking at bringing staff on who have never even been inside of your center before. So that creates another risk factor, not only for yourself, but for the families that you service, as well as your staff that are there as well. So when we talk about recruiting, we're looking at a larger picture. Where are you finding your staff, and how are you going to bring them into the center safely? And one of the things we want to look at is how you're interviewing them. One of the things that I talk about in the book is you want to do your first interviews over the phone. Well, when we couple that, after you've narrowed it down to your final candidates, you can complete a video call with them. That can be your initial face-to-face. And one of the things that I like to see happen is a group interview where you have maybe a parent or you have staff that are involved in that. But during these times, that's not really the best idea to have a group interview in a close setting. Even if you were to 6 feet social distance, wear a mask, it's just not as ideal as it would have been in the past. So video chat, have everyone as part of a video chat, and you can still have your group interaction, but it's just you're not in the same place. And we've become more accustomed to speaking through video and talking with people. So I think it's becoming less of a distractor and more of just a norm for people going forward, because everyone's talking with their families that way, staying connected as well.
Exactly. And I think those are such good points, especially, you know, now more than ever. I think recruitment is going, you know, I would imagine it's going to rise right now, given, as you said, the concerns of returning to school. In fact, I read an article this morning from Time Magazine talking about how they're seeing a shift in teachers retiring instead of returning, because at this point they're, you know, they're thinking, I'm not going back. I may as well just, you know, retire. So I think recruitment will certainly be top of mind right now. And thank you for sharing those tips, as obviously it is changing. It's, you know, you have to make changes in light of this pandemic to make sure everyone stays safe. So especially as part of that, do you recommend within these interviews, do you recommend changing your interview questions? Are there different things that you're thinking about? So for example, you know, asking a candidate, how would you support play with our new social distancing policies or something of that sort?
You want to make sure that they are on board with the pandemic and that they are aware that keeping children safe through putting proper measurements in place, and what are their thought processes on cleaning. We talk about hand washing as a front line straight behind social distancing in curving, COVID-19. Well, when you're working with small children, you have to really enforce hand washing on top of social distancing. So your questions want to relate to how they are going to make sure that the toys are clean in the classroom, that they're sanitized. What is their thought process on making sure that the children wash their hands throughout the day? Not just before they eat or after they eat, but while they're playing. Will they understand that that is now a necessary measure to institute into the program? But at the same token, I would not put as much weight on the fact that they have or have not put into place in their mind how they would react to implementing COVID-19, because it is still very new.
Mhm.
And if the center has policies, I would like to see that when they're hiring their staff, that that's the first thing that they train them on, to make sure that they're aware of what the center has implemented to keep the children safe, to keep the staff safe. And I think also that that should be a talking point during the interview, that the center makes the staff feel comfortable with working at the center, knowing that they are focused on keeping not only the children safe, but the staff safe as well. So they're taking temperatures when the children arrive. They're taking temperatures periodically throughout the day. What is their policy when children are running a fever? Do they have an area where these children are isolated away from the other children, keeping both safe, the children that are well as the child that is ill, so that they know that they're taking not only COVID-19 seriously, but they're taking their health and safety seriously as well.
I love that. And I think that's so important too, because if you think of any interview situation, it's not one-sided. You know, the candidate and the interviewer are interviewing each other. And so I
Correct.
think to that point, I think it's so crucial that the center is saying, we care for you, here are our policies. But I also like that you say, make sure that the candidate's on board with those policies. So it's not necessarily about putting them on the spot of saying, how do you navigate all of these potential scenarios? Instead, it's saying, here's how we would navigate them. Are you cool with that? Will
Yeah.
you follow these processes? So I like that. That's great. Um, and I think you really already touched on this. And I wanted to see if you wanted to expand on, how do you think COVID-19 has affected training, a typical staff training? So I know you mentioned it's something that it should be the very first component of training. Is there anything else you'd like to add to that?
This is sort of different because we're bringing back our existing staff, but they also need that training.
Mm-hmm.
And so you want to make sure that before they are expected to implement your policies, that they're also trained on what you're putting in place, and that you follow up. You don't just say, this is what we want you to do without any follow-up, because this is new. Because the one thing is that with COVID-19, it's very different than anything else that we've ever experienced. And that is that it's not just affecting your work life, it's affecting your personal life as well. And so you can't say that we're separating work and home. We have to create a work balance that makes people feel safe and comfortable, so that they can then go home and feel safe and comfortable, because we know that the contact that they have at the center doesn't just negate them when they go home.
Right.
And so training is very important to make sure that they're aware that you are caring for their family as well.
And I think that really leads into retaining as well, where you are demonstrating, you as the center are demonstrating the practices you take to care for your employees and care for the children you serve. So, during this time of, potential fear and uncertainty, what are some ways in the perspective or in the mindset of retaining your staff, what are some ways that you would recommend centers do to keep morale high? Maybe it's a community of practice, maybe it's something else.
In terms of keeping morale high, that is going to be tricky during this time because, like I stated, it's not just this is something that's happening at work. This is something that's also happening at home. The one thing that really hit home for me is sick days. Sick days are very important because when we look at time off, we never look at specifically sick days off. We look at, PTO days, but we don't look at separating that out and saying, these are days that you will have just in the event that you're sick, your family is sick, or you have to care for, an extended family member like your parent or your sibling who, doesn't have family, and you're the person that needs to help them. And so if we could make a separate line item for sick days, I think that would be a way to retain staff because they know that during this time. So say for instance, you're helping your sister with her husband who is ill. You go over there to help, and then you find out that your brother-in-law tested positive for COVID-19. So you can't go to work because you have been exposed, but not by anything that you've actually done yourself. You weren't out at a party, you weren't, ignoring social distancing. It wasn't anything that you actually did wrong, but now you're in a category and you have to miss work. So if you have sick days, then that's sort of their way of saying we care about you, especially during these times. You're going to still be able to survive because a week off in the early childhood field can, pretty much break some individuals if they're not receiving that paycheck. And using up your vacation time for your sick time just doesn't seem fair.
Right. I like that. That's a really good point. Separating it out that, some industries do that and some don't. And I think that it's crucial, especially now,
Yes.
because you're certainly not sitting by a beach enjoying your PTO if you're homesick
Correct.
or caring for someone who is. So this was incredible. Dr. Bond, thank you so much for sharing these tips on, in the light of this pandemic, how to recruit, train, and retain your awesome dream team. So thank you so much for joining us. Go to griffinhouse.com and learn more about Dr. Bond's book. It's titled Build Your Dream Team, How to Recruit, Train, and Retain Early Childhood Staff. So it's right on the homepage, right at griffinhouse.com. So take a look at that book. Thank you again.
Thank you for having me.